Hello viewers, today let us discuss endometriosis. So if you are a woman and you are having issue with chronic pain during your menses, if you have serious pain during intercourse, that is when you are having a deep penetration, if you are also facing infertility issue, then this video is practically for you. So I mentioned endometriosis is what we are here to discuss about. Endometriosis. What is endometriosis? Endometriosis is a chronic condition where endometrial tissue-like or tissue that resembles endometrium grows outside the uterus, mainly on pelvic organs, leading to inflammation, pain, and sometimes goes with infertility. So with this definition, I want us to also go with practical example of what endometrium is and what is endometriosis and what it can cause to you and how, where and how to get rid of it if possible. This pear shape you are seeing is a structure of a womb. It's a womb of a young lady, for example. In between this structure you are seeing here, the central place you are seeing here, as you are seeing it, let me tick it so that you can see it. It is called the endometrium. Endometrium. The endometrium. What happens here is that if this endometrium with the tissue inside may also grow outside your womb, places like fallopian tube, places like ovary, places like urinary bladder, places like even in the cervix here, even the intestines, they can grow within those areas that I mentioned. If this endometriosis grows within any of those areas that I mentioned, what are the symptoms will you get or will you have to ensure that it's likely to be as a result of endometriosis? Now, before I go on, what causes endometriosis? There are some causes theoretically believed, but the major one which is widely acceptable or widely followed that could cause this endometriosis is a kind of situation where someone or a lady rather is having a retrograde menses. Retrograde menses. That is to say, when the woman is menstruating through this area here, it flows through the cervix down to the vagina. But sometimes if this flowing is going, some of the blood of this menses may flow back through the fallopian tubes down to other parts of the organs of this uterus or the other pelvic organs of the around the uterus rather. If it flows back, the part of it that flows back may stay there and form a kind of tissue that is called endometriosis. Now, what are the symptoms of endometriosis? You have pain. One, you have inflammation. Inflammation, pain, as well as infertility. Why is all of this thing, or even pain during intercourse, why is it causing all of this? It causes it because when the time of your period as a woman comes and you are not pregnant, the estrogen and the progesterone have to work together to build up this endometrium. They have to build up after your menses, so that if there is any conception or implantation of a baby, it will welcome it in order your pregnancy to grow to term. But if no conception, if no implantation, the estrogen level and the progesterone level have to drop down. The process of dropping down will break up this endometrium. So in a case with a woman who has a tissue that resembles this endometrial tissue outside this uterus, outside this endometrium, maybe in the fallopian tube somewhere here, or in the ovary somewhere here, or in the urinary bladder or intestine, like I earlier mentioned, will also break down if there is no pregnancy. They are doing exactly what this endometrium is doing, this tissue you are seeing. You as a woman with this uterus, there is a space that the menses flows out every month. But in a case with fallopian tube endometriosis, or ovary, or intestine, or urinary bladder, it does not have any space. Thereby it is being trapped, and once it's trapped, the blood will start gathering around it, or gather around it. And this gathering of the blood causes scar formation. Causes what? Scar tissue, which is called adhesion. So because of this scar tissue, anytime your period is trying to flow to come out on your monthly basis, you start having a very serious pain, looking for analgesic to cool it down. Or maybe if you are having fun with your hobby, you will start having serious pain. And as a woman also, if you are trying to take in, you find it very difficult to take in. It could be as a result of endometriosis. Now, the one mostly that you can be very sure as a woman when it comes to endometriosis is a cystic mass that grows within this ovary, which is called chocolate cyst. They call it chocolate cyst. Chocolate cyst. Or you can as well call it endometrioma. So you see it, and whenever you go for ultrasound, maybe because you want to check your womb, your fallopian tube, your ovary, and you discover that your sonographer tells you that you are having endometrioma or chocolate cyst, it simply means that you are having this endometriosis, because endometrioma forms from endometriosis. And how do you get rid of it? Your doctor, who is well experienced with it, can use a procedure called laparoscopy, a device they use to check, to open a space, a tiny space inside of you, to view your pelvic organ as well as the intestine. If there is a tissue of endometriosis, this ectopic tissue of the endometrial tissue, either in the fallopian tube, in the intestine, in the urinary bladder, or in the ovary, they remove it. By doing that, you'll be fine. I hope you learned something very useful from the discussion, which is called endometriosis. If you actually did, do me a favor so that you can as well click the like button. If you have not followed me, follow me as well, and also drop your comment in the comment section. As you do so, you are pushing this video to the rest of the world so that they can also learn, because somehow, somewhere, a lady is suffering from this medical case called endometriosis. Together, we can elevate one another. Thank you very much.